So there have been several studies examining the impact of the pandemic on weight gain in children. So, I think we knew early on that the pandemic impacted weight for both children and actually adults too. They're examining data from Kaiser that compared the BMI of, I think, over 2,000 children during the pandemic with the BMI of children from the year prior to the pandemic starting. And they found significant increases in rates of overweight and obesity on the order of like 8% increase among 5 to 11-year-olds, 5% among 12 to 15-year-olds, and 3% among 16 to 17-year-olds. Another example, like the CDC also looked at national data and they found that rates of BMI increase nearly doubled during the pandemic. So we knew that early on. There was a lot of data early on. And I think now we're starting to figure out why that happened. And so a lot of the newer studies that you're seeing now are probably describing some of that, as well as, like you said, some of the impacts of long COVID on weight in children. Some of the more recent studies have looked at reasons for weight gain. So some studies show that children were more sedentary during the pandemic, for example, or they had abnormal eating patterns during the pandemic. Still other studies show that sleep and routines were abnormal. And then a lot of people looked at the impact of stress and mental health challenges and stressors like food insecurity on weight gain. And we know that all of those things impact lifestyle as well as weight too. And so I think we're learning more about the why, in addition to understanding more about sort of the nuances of weight gain during the pandemic and because of COVID. I think our study was unique compared to the prior studies that I described, because we leveraged something called the N3C database. So this was a collaboration between investigators at Nemours Children's Health, the University of Delaware, and several colleagues through that N3C collaborative. And N3C stands for National Clinical Cohort Collaborative, which is actually funded through the NIH. And it's a real-world database of electronic health data from over 90 institutions across the country. That's all harmonized together so that investigators can study the impacts of things like COVID, for example, on health outcomes. Until recently, that N3C database was mostly focused on collecting data on patients with a diagnosis of COVID and then matching them to controls, which I think makes that database really unique and robust. And so we were able to leverage that database. It ended up studying a really diverse group of over 11,000 children across the country with a diagnosis of COVID, and compare them to the same number of patients of similar demographics without the diagnosis of COVID. And so I think we're uniquely contributing to the literature by looking at sort of that question of, does having a diagnosis of COVID impact that weight gain that we know happened for all children during the pandemic? We were also able to look at a subgroup of patients who were hospitalized due to COVID, and then also look at weight trajectories before and after diagnosis. And what we found is that, both children diagnosed with COVID and those not diagnosed with COVID gained weight. So consistent with the literature, all of the children just generally on average gained weight. But what we saw is that patients with a diagnosis of COVID gained more weight, and actually gained more weight after their diagnosis than before their diagnosis. And interestingly, non-hospitalized children actually gain more weight than hospitalized children. And those trends still held even after adjusting for factors like time, demographics, and baseline weight status. We don't have data on why that happened, but we generally suspect that some of the factors that I mentioned before that led to weight gain in children, like being more sedentary, having disrupted routines, experiencing more stress, were probably more likely to happen if a child was diagnosed with a COVID infection than if they weren't. There's also some newer evidence to suggest that having a COVID infection and long COVID might lead to metabolic changes due to like the pro-inflammatory nature of having a COVID-19 infection and how it impacts the pancreas. So all of that together, I think, gives us a deeper picture into why children may have gained weight during the pandemic and how we might be able to prevent future weight gain in children.